My goal for this supplemental video is to really emphasize the value of quality improvement tools by providing you an external resource that I think has a lot of value. The information for this supplement is really going to largely come from this book here. It's Q Solutions Information Management Textbook. And I think it has a lot of great value for really looking at, all right, how are quality improvement tools constructed? When should I use each of these tools? How should I use them? So I think it just gives you a little bit more depth than what's provided in our PAP textbook. So hopefully you enjoy this supplemental video. There will be some repeats as far as some of the tools, but that's the goal, is to really reinforce how these tools are used. That way you can start to use them in your own workplaces. Before we get truly formally started, I did want to kind of break down where these Q Solution textbooks come from, because there are a series of different textbooks kind of overviewing a series of different topics, and kind of why they're available is to help prepare for the National Association for Healthcare Quality's CPHQ exam, which is the Certified Professional in Healthcare Quality. So if you're ever looking to make a move outside of medical imaging and you want to look into the quality field, this is a credential to actually look strongly at, because it's general healthcare quality. So it's a lot of the transferable skills that you would gain from a QM certification would be demonstrated just in a different context. So the Q Solutions preparation textbooks are indicated here. So there's one in leadership and management, quality and performance improvement, there's a safety, there's an accreditation, there's a readiness section, and of course the information management section that a large amount of this lecture is going to actually come from. So this is another professional credential to consider if you absolutely fall in love with quality. So something to just point out there, so give you some general awareness and get you thinking about some long-term options. Now, we talked about brainstorms before, and brainstorms are not overly complex to be able to use, but how we construct them and how to use them, you can see kind of here. So of course, the first step is to define the topic, get that topic out there, get people to start to think about it for a little bit of time, and then start to gather all the ideas. And just remember that, yes, all ideas are good ideas. They're all going to have some type of merit. But ultimately, in the end, we need to filter down to be able to determine, the best ideas. But the brainstorm is intended to be able to give us a lot of great ideas for potential solutions. So that's, when to use it is when you need to generate a list of ideas, or perhaps it could be used for a cause and effect diagram or a Fishbone tool as well. MultiVoting is a great process to be able to pare down all of those brainstorms ideas and to really just be able to start to identify the key focal areas that you need to pursue. So kind of how it works, you can see you're going to generate a list of ideas, you're going to number them. Of course, you want to combine similar elements, so one person isn't voting for one thing that's very close to another thing, and then in the end they both get washed out. So make sure that you do combine all of the very closely related ideas. That way they're not kind of phased out because one person thought it was this and the other person thought it was this, and they weren't kind of totaled together. So that's an important consideration. Typically, so 1/3 of the vote is needed to be able to move forward. So say that you have, we'll say 10 ideas. At least 4 should be moved forward to the next round, and then beyond that, you can still think, all right, how can we proceed forward and pare this down with additional votes until we get down to that one final solution. An activity network diagram, pretty interesting way of looking at things, and often the reality is that things happen simultaneously and that certain steps are dependent on other steps. So while this is sort of like a flowchart, it's really a little bit different than a flowchart in that there are multiple processes happening simultaneously, and there are dependencies that are involved with those processes. So you can kind of read about how to construct it, when to use it, for simultaneous processes when they're occurring, but I really want to just emphasize the picture because I think that will help to elaborate on what this particular network tool actually looks like. So you can see the starting point here, and you can see the tasks. So each task is shown in their own respective boxes. So the arrows themselves showed the dependencies. So what does that mean? So here's task 1, saying that is dependent on essentially it's a dependency for task 3 in order for that to be able to begin. So task 3 cannot begin until both task 1 and task 2 have been completed. Well, when we look at our diagram, how do we know that? All right, so this is basically saying, so task 1 is going on, task 2 is going on, but both of these arrows are saying, all right, these things must be done before we can even get to this point. And then task 3 has to be completed along with task 4 before we can even get to task 5. So you can see some of those simultaneous processes that are going to take place, and just helps you to understand this happens before this, and really kind of starts to get that organizational scheme going. So it's a little bit different than a flowchart, because I think a flowchart is just one process that's happening. Yes, there are yes/no kind of causal directions as far as how to proceed, but overall this is more of an overlapped type of process. Deployment charts are pretty cool. I actually prefer something called a Gantt chart. So if you're not familiar with the term Gantt chart, you kind of look that up. A Gantt chart is essentially a fancy way of establishing tasks with timelines. What a deployment chart does, it kind of takes it to the next step. I would say the Gantt chart is kind of like step 1, so you have the task in the timeline, and then step 2 with the deployment chart would be assigning it to a specific person. So it's not just a task that's hanging out there, but there's an individual that's going to have some responsibility or ownership over a particular area. So when you look at the deployment chart example here, you can see that in this example, the person that's going to be responsible for these are kind of like individual areas. So individuals in the sales department, individuals in the order entry department, customer service department, operations. Sometimes it works better if there's names in here. So, John, Steve, Mary. That's great, especially if it's a short-term project. If it's a longer-term project, you want to think about organizing it more in departments or professional roles because of turnover, and saying this role is responsible rather than this individuals. But if it's short-term, yeah, I think names are probably the best way to go, because you're basically saying, no, it's not a department that's doing this, but it's a specific person, and then there's that accountability factor that kind of sets in. But you can kind of see, all right, these things are happening. Steps 1 through 4 are being done by sales. Steps 5 through 7 are being done here. And you can kind of see so on and so forth. Sometimes, this step may be dependent on this step. So, the deployment chart has a function, but it's not perfect. And I'll show you a better example kind of going forward. What I like about this example of a deployment chart here is that it kind of combines elements in the form of a flowchart. So when you look at flowcharts, you always know that your starting points and your ending points always have the rounded corners. So they're not rectangles here, but they're rounded. So that tells you where to begin and where to end. So why I like this is that it actually gives you the function. So this is an individual. Peter is going to start this process. He's going to kick off this process. Peter's process is going to be then sent to Paul, and Paul's going to do the next 2 steps in the process. Simultaneously, once Paul completes his process, he's going to then send his work to 2 different departments or 2 different individuals. So both Mary and Peter are then going to have some tasks. Once Mary finishes her task, we're just waiting essentially on Peter to finish his 2. Once they both finish, kind of coming together, process is complete. So it's a better way of looking at it, I think, than what we looked at before, because you can see that, not always is it just going to be one person kind of going through their steps and then passing it on to another department. But just like what we saw in the network diagram, at times it's going to go from one person to the next person, and just having that clear organizational structure is good. So I kind of like this fusion model a little bit better. However, it's largely because I am a big proponent or fan of kind of the flowchart based model. I think it makes a lot of sense to organize it in this pattern. So histograms can be presented in a variety of different ways. In order to construct an appropriate histogram, you have to have an appropriate amount of data points. A minimum of 25 data points is going to be what's necessary. Oftentimes, the more data points you have, the more accurate it's going to be. But what you're going to do is you're going to order it or categorize it from smallest to largest. And what you should see is typically is continuous intervals. And I'll look at this graph here to be able to show you, hey, what does continuous intervals mean? So, there shouldn't be any gap. So we'll say that this is, 16 years, your final year of 16, you're still within this category. And then once you immediately turn 17, you hit this category. So it's continuous though. So you can see 30 to 31, 50 to 51, 65 and older type of thing. So there is some type of continuous data that's being collected, and it doesn't have to be age. Think about it as being anything that's continuous. So it can be time, it can be a continuous amount of radiation dose. So you can say this is 0 milligray, and then you can kind of continue forward depending on what studies we're actually doing. Are we talking about diagnostic X-ray? Are we talking about CT? Are we talking about radiation therapy? That'll kind of determine what your starting and ending points are. But it's nonetheless it's continuous intervals, and kind of being able to show how many instances are happening within that given measured interval. So in this case, you can see quickly you can tell in terms of hospital census. So we'll say that these are patients that are coming in over a given period of time, and determining what their age of those patients are for that facility. You can see the majority of patients, about let's see, that's a 20-point scale, so we'll call that 82. About 82 patients were 65 years or older. So it just kind of gives you that clearer sense of kind of what the distribution is of your patients. So you can see, yes, you're not getting a lot out of this demographic, but you can see you're serving more older individuals than you are younger. So you can see kind of that positive correlation here, rather than the negative correlation, which would be a lot of patients up in this area, this age group, and then working its way down. But you can see, yes, as individuals are aging in general, with the exception here, more individuals are coming to the hospital, which you would tend to expect unless it's a pediatric focused institution. So in order to kind of shape this out, you can kind of see how to organize it. Again, the horizontal axis, or the x-axis here, right in here, would be your categories, and they should be continuous. And then your vertical axis should be the numbers of points that are happening at those given categories. You can see just another example here, and here's a time-based example. So we'll say, you can say that this is anything. We'll say that these are minutes. So that's 1 minute, 2 minutes, 3 minutes, 4 minutes, 5 minutes, 6 minutes. So we'll say that what you're studying here is chest x-rays in your facility, and how long that they're taking from the point that patient walks into the room and the door goes closed to the time that the patient walks out. So you can see, all right, by far, the majority of time is taking, we'll call that 3 minutes, is taking 3 minutes here. So, of your total count, we'll say that's roughly, that appears roughly at 15 individuals finished at 3 minutes. You can also see that this is kind of almost bell-shaped, so it's almost normal distribution. So this is really what you would expect. So the majority of instances should happen kind of in the center, and then perhaps these are outliers over here, and that's something that that would need to be investigated kind of going forward. But nonetheless, it's going to show you that continuous distribution. So it's just organized around where things are actually happening based on the counts and based on the categories. Now, a Pareto chart is a little bit different in terms of an organization, because it's not continuous, but it's organized based on the amount of occurrences. So what's occurring the most is always going to be on the far left. What's occurring the least is always going to be on the far right. And then when you can kind of look at these types of things, you're looking at it kind of twofold. So a little bit different than how we looked at it before, where we had, truly just an x-axis of categories and a y-axis of counts. But now we're also looking at percentages. So when you look at this particular instance and the pneumonia, congestive heart failure, COPD, HIV cases, so you can kind of see what's happening in this particular facility for whatever reason. You're seeing the most pneumonias, and when you look at that 25, so you basically, how do we get to the percentages? So 25 counts. This is a 15 count. This is, we'll say 8, and then we'll say that appears to be, we'll say 3. So kind of what you do is you total all of those up, and then you're just looking at percentages. So, 25 of however many the total is corresponds to, we'll say that's 45%. So 45% of what we're actually seeing are pneumonias. Then you can say your top 2 causes, or at the 80% marks, when you total this one plus this one, and you say how many are those. Right around the 80% mark, you're seeing the most pneumonias and congestive heart failures. So perhaps, those are the areas that need to be investigated the most for whatever reason, whatever you're trying to study. And it doesn't have to be, specific codes. It can be absolutely anything that you want to look at. It will say that it's repeat procedures for CT contrast-based studies. So how often are those happening versus how often are, how often is it happening for this protocol versus this protocol versus this protocol versus this protocol? And once you kind of identify those types of things, then you can create those action plans. So I wanted to kind of give you different ways of kind of looking at how to use this. But overall, when are you going to use this is that you have to investigate, factors that are happening, most frequently. And so that may be in a result of cost. It may be the result of time. It may be just a result of frequency, or how often, the count of something that's occurring. So a Pareto chart is a really great tool to be able to kind of show you not just the distribution of things like we saw in the histogram or bar chart, but more of an ordered occurrence. So it gives you that very, very clear idea of what's occurring and when. So just to further emphasize the use of a Pareto chart, kind of going forward, we kind of have a couple different organizations here. So this is surgical setup errors. You can think of, hey, how does this apply to an area like cardiac cath or interventional radiography-based procedures? And you can kind of say, all right, it's a little bit relevant there. But 80% is that magic number. So anything that's hits at the 80% points are basically the factors that you really need to start to investigate. And anything beyond that, so kind of the upper 20 are things that are a little bit more marginal or less important in terms of why setup errors are actually occurring, and what to actually do about it. To kind of look at it in a different regard, you can see another example here, and again you can see where that 80% is, and say, all right, at 80%, when you basically, so you're just, again, you're totaling up everything. So you're totaling, and then essentially just saying, how much of this total is actually occurring. So you can see for this particular example, so there are problems with a particular file. We'll call it a web-based file. Maybe it's a information brochure for parents about radiation safety or something like that. So there's errors with that being able to be downloaded. There's errors with actually locating the file. We'll say locating the file on the website. Maybe it's read-only. Maybe it's in PDF format, and it's actually supposed to be an acknowledgement statement that you have to sign. That would be better in docs format. Those types of things. So these are the areas that were identified because they're in that 80%. So those are the kind of those target areas to investigate. And these areas were problematic. They created some problems for some, but they were less frequent in their total occurrence. So this is a different way of looking at things. But again, the 80% is going to be key, because those are the factors that kind of 80% of the problems are these problems right in here. So let's fix those. I absolutely love the Fishbone diagram as well. It's cause and effect chart. Basically, the effect is something that you want to improve upon. So in this case, the effect was quality. So there are different ways to kind of look at it as far as when to use it, why to use it, but really you're typically trying to identify some type of root cause. So you find an issue and you want to be able to solve it. So we're going to say this is poor image quality. And determining why poor image quality is taking place. So essentially you're going to start to brainstorm, categorically brainstorm, why is this actually occurring? There are kind of schools of thought that say, hey, let's the main primary categories are either the 4 M's or the 5 P's. So the 4 M's are kind of what's listed here on that particular graphic: manpower, so people, methods, machines, and materials. Now the 5 P's are just little bit different way of looking at it, and I think the more categories that you have, actually, the more complete your cause and effect chart is going to be. So I support more of a 5 P's than a 4 M's. The 5 P's are patrons, which we would consider our patients, our customers. People, which we can say that those are internals, individuals, provisions, the places of work, so our environment and the procedures that are taking place. I'll show you some examples kind of going forward that I think are even better than this, and I think it's because at times we can standardize things, and standardization is a good thing because it makes everything consistent. But for issues of cause and effect, it's not always consistent, and at times we have some very specific categories, and I want you to start to think about things in terms of specific categories. So going forward, I think you'll be able to see that. So nonetheless, on the far right, you always put your effect, and kind of from that effect you have that arrow going forward. Let me just zoom in on that so you can see kind of that forward arrow. So all of these factors are affecting this. So from there you put all of your categories, and again, the more specific or the more categories you actually have, the better. Now from there, the bones on the fish are essentially going to be all of the sub factors that are actually affecting it. So machinery, we'll say that this is radiology equipment. We'll say we're talking about digital radiography. So in digital radiography, maybe you're having issues with the collimation, maybe you're having issues with the grid, maybe you're having issues with setting the actual technique, utilizing the AEC chambers. So you're just kind of being specific here as far as what's actually going on, what are potential causes of quality as they relate to that piece of equipment. So it requires that brainstorm. It requires you to generate a ton of ideas and then categorically place them where they're supposed to go. So a brainstorm is definitely a prerequisite activity for a cause and effect type of diagram. So it's a good tool, like I said, to be able to identify the root cause, but it's also being able to say, all right, these are some factors that need to improve. This is going to lead to more success and to kind of creating some active change. So it gives you kind of a bigger way of looking at that brainstorm, but kind of paring it down categorically so you can really start to perhaps identify a specific category that's going to be of most concern for you. Now, here are some examples of some different ones, and I'm just going to put this one out here because, I mentioned the 3 M's, but this one actually has an example of 6 M's, and like I said before, I like more categories because it becomes more specific as far as, what is the actual cause and, how is that resulting in the effects. So you'd be able to better demonstrate those relationships there so you can see what those 6 M's are there as well. So if you decide for your quality improvement project to be able to say, all right, what is the root cause of this after it's identified, the more categories you can have, the better. Now I'll show you an example of looking at things a little bit different with this completed version of what was classified as the effect of being poor quality product. Now you can see in this case it doesn't use the 4 M's, the 6 M's, or the 5 P's, but it breaks things down based on specific factors, and you can see what those look like. So this is busy because a lot more thought went into it. So whenever you're seeing some of these factors, we'll say, let's zoom in on the workers themselves, and that's going to be a little bit grainy and blurry, just a little bit more modeled here. Not enough pixels here. So what you're looking at here though is qualifications. So qualifications is a big part of what's going on with these workers. Are they actually qualified to produce these quality products? And with qualification, it's not just qualification, but qualification has other factors. Maybe it's years of experience, maybe it's their education, maybe it's been how long since they've been trained, how long have they actually been in the field. So you can see kind of some of those subcategories that go along with those. Which this is a subcategory. We'll call this a super subcategory here. So you can see categories, subcategories, and then a subcategory there. So you can kind of get a sense of what's actually causing those issues and really starting to dig at the root of those issues. That way an action plan can be established to make sure that you're improving effectively. So in a nutshell, that's a fishbone diagram. Or a cause and effect type of chart. So you can kind of see how they work there. Scatter plots. So 25 pairs of data. So what you're looking at essentially with a scatter plot is that you're trying to plot the data to be able to determine if there's any type of relationship with a given variable. So you have multiple variables that are taking place. So we'll say that an example, time and radiation dose, or time and the amount of procedures that are taking place. So you can be able to see kind of those relationships. In this case, you have what's called a positive correlation. In this place, you have a negative correlation. So basically, as something is increasing, the amount of effect is increasing as well. As something is increasing here, the amount of effect is decreasing. So it's be able to determine if there's a relationship that exists. And in this case, when you see all of those data points plotted, you can say, hey, this is completely random. There is no relationship between these two variables. This can't be actually the factor that's causing this. That the relationship isn't demonstrated by the analysis data. So you're basically just using this type of thing to be able to determine kind of those relationships that may or may not be present with some types of variables that you're investigating further. Prioritization matrix. Absolutely love this because I think it creates the most objective type of tool. In this case, what's being created is what's called an L-shaped matrix. It's just something that has multiple. So you basically have a vertical column and a horizontal row of categories. So it's a way of prioritizing and assigning the highest value in a very objective manner. So that way you're not, quote unquote, pulling things, just to do things, or you basically have some reason behind what you're actually doing. So what you can see is that there are, in this particular example, there are 5 things that need done within this department. And basically, when you're strapped for time, what do you actually do? Or you're strapped for money, what do you actually choose to do and why? So in this case, these are the areas that were determined are the priority areas, but only one can be selected. So what do we choose? Well, we're going to determine, what is most important for us. So of course, dollars and what we have available in our budget is going to be important. How does it align with our mission? How does it align with the actual strategic plan that we have within our facility? What's it going to do for accreditation? What did the physicians feel? What did the staff feel? So in this case, they're giving basically physicians and staff, equal weight. I don't know, whether I agree with that, but nonetheless, that's how they prioritize things within their facility. Yes, doctors have a lot of pull because, at times, if especially, say it's a say it's an OR case, say that these MDs are actually surgeons and they need some type of instrument to be able to perform some type of procedure. So yeah, at times, physicians are going to have, more input than staff, and sometimes, vice versa. It just depends on what the piece of equipment actually is. So in this case, you can see kind of how this is ranked. So there are 5 numbers, and you're basically prioritizing this. So this is the cheapest. The newsletter, producing this newsletter is cheapest, but the X-ray equipment is the most expensive here. So then kind of from there now, what aligns with this strategic plan the best. So skilled nursing is kind of the objective to be able to say, yeah, that's what we really want to focus on. So in the end, what you're actually trying to see, if you haven't kind of figured this out yet, is that where it's like golf. You're going for the lowest actual score. So in this case, when you prioritize things, all right, we need to develop skilled nursing. That's the priority, because we need to actually be able to meet those. So it depends on how you actually look at this. I like to actually rank these things in terms of ranking, 1 through 5. Once you get over here, they didn't actually rank them 1 through 5. They assign these as, oh my gosh, these are like so very important to meet accreditation standards that, we need to act on those, immediately. But, this is, you can see 1 through 5 is in here and 1 through 5 is in here. But nonetheless, I probably would have put a 1 through 5 in here just so you can actually prioritize there. But in the end, when you total these numbers up, this is what wins out, and of least importance is actually repairing the roof, which, it may be like, really? You don't want to repair the roof? This is what you do, but you have this objective thing as saying, this is what we have to do, and this is the reason why. And maybe it's for accreditation, maybe there's a lot of concerns, maybe it's a patient safety type of issue. So, it's a great objective tool. So start to use these prioritization matrices in your practices to actually start to make some decisions. Now, when we look at this prioritization matrix, I'm going to super confuse you because I'm going to completely change course from what I told you before. And it's just to allow you to understand that prioritization matrix can be set up in a ton of different ways. So I elaborated on how I like, for this instance, this is, 1, 2, 3, 4, 5, 6, 7 instances, 7 issues here. And I like the 1 through 7. But at times, not everything is going to have equal weight. So perhaps the frequency or the importance or the feasibility is much more important. And then the other thing that I want you to get out of this is that, at times, I said, hey, it's like golf. That last graphic was set up like golf. The lowest number was most important. Now, I want you to look at this, and I want you to determine if the lowest number is probably most important here, or if whether you feel like the highest number is most important. So the highest number is long wait times followed by incomplete labs. And the shortest are broken down ambulance and not enough materials in the labs. So it becomes a little bit more confusing in terms of, what actually is your priority. So in terms of the level of importance, let's look at that. What is most important here? Well, long wait times by the scale are most important. So this one is actually adding the opposite way. So it's like, football or basketball. So it's actually totaling up in this case. So that is the one thing that I don't like. We're either playing golf or we're playing football. We can't play both of them simultaneously unless we have some kind of new sport, football, golf, or something. But that's kind of aside from the point. The bigger point is that I want you to create systems of priority and be able to objectively explain those to your administrators. So flowcharts, again, are great, but I do want you to make sure that you understand your symbols. So the first thing to do with a flowchart is always to recognize, what symbols to use and when. You're going to make sure you select a process, and you're going to outline that process. You're going to sequence those series of events, and you're going to determine how different variables or different questions are going to impact, what that decision path actually looks like. So super simple example here is provided by this particular textbook, and so your alarm goes off. You have the opportunity to hit that snooze button. If you do hit that snooze button, yes, I hit it. What happens? Well, your alarm's going to go off in another 5 minutes or another 3 minutes or whatever you have it set at. If you don't hit the snooze button, hopefully you're getting up, followed by brushing your teeth, followed by showering, getting dressed, and leaving for work. Hopefully you're not just, hitting that, turning that snooze button on and, falling back to sleep. It happens to all of us, but, based on this flow chart, you're supposed to be getting up and, kind of preparing for your day. So it's a great, super simple example, and sometimes the simplest examples are best to kind of drive home the point. But what I want you to recognize is that these shapes are important. So whenever you see that diamond, it's always that decision point. It's always going to have a yes and a no branching off of it, because that's going to tell us our causal direction or our pathway of, yes, this is what happens, so this is where we go. No, this is what happens, this is where we go. Kind of some of those directions are there. So in this case, the yes has an arrow. Really, all of these should have arrows, so you're kind of pointing at that direction. If the arrow isn't present, maybe we leave for work, and then we get dressed, and then we shower. It doesn't make sense then. I obviously we know which order it goes in, but at times if the process is more complex, there are times where it's like, I don't really know which order this actually goes in. So it is important to make sure you always indicate those arrows, and it's always nice and clean and organized as well. Now, a run chart is used when you want to be able to show that variation, want to be able to, perhaps you're investigating, hey, I'm doing some practice quality improvement, I'm implementing this, I want to see how this change impacts it. Are the doses being lowered? Are the doses raising up with this changes? What's actually going on? So it's just a different way of kind of looking at things. So that run chart, basically, you can see in this particular organization, the x-axis is our time interval, the y-axis is our count. So in this case, those data points in the first quarter of, we'll say 11, we'll just make that up, we'll say that's 2011, we're here, and then you can kind of see where were the instances, so on and so forth. The more data points you collect, the longer periods of time you collect this, the more of an idea of kind of how your, we'll say, department or how your shift is actually performing, or how you're actually performing individually, is kind of be evaluated and weighed here. So somewhat like a run chart is then a control chart. It basically is a run chart, except it has upper and lower control limits that basically are warning lines, and saying, hey, when we're exceeding this or we're not reaching this, that there's actually an issue. So you can see that this is within expected intervals within here, but hey, what is actually going on? Did we forget our preventative maintenance here? There's something wrong with our units, something that needs fixed. So anytime we exceed those thresholds, we need to essentially be able to investigate those factors. So when you look at this is another great tool for process improvement. It's just a different way of displaying variation, but it's also a different way of kind of creating those actionable steps for when things actually do exceed your planned limits. What are we actually going to be able to do, and kind of how are we going to be able to change going forward? So all in all, this is similar types of information that I presented before, so it's a lot of redundancy, but I wanted to give you some different perspectives, some different graphics, and a different textbook resource to be able to say, all right, how do we use these? When do you use these? Why do you use these? Because I think if you can start to apply these things in your workplace, you're, number one, going to get recognized. You're going to help to advance your career. Hopefully you'll be able to kind of pursue some things that are of interest to you. But you're also going to be able to make that active difference and be that change within your workplace. So, you are always empowered. I am officially saying I empower you to be able to make that active change. I want to be able to hear your success stories of, hey, Professor Moore, I just tried this flow chart. It really solved this process. It was a complex process. Everybody was always not on the same page. There were continuously steps being missed, and now those steps are not being missed. So those types of things. Creating that change, enhancing the patient's experience, promoting departmental safety are all important factors. So thank you so much for watching.